G'day. Applying an at-risk strategy may well give us a COVID vaccine much earlier than expected. So what's that all about? Dr. Anthony Fauci is a name you're probably all familiar with. He's the guy that has led the US task force on the COVID-19 crisis. And he says that we're probably not going to have to wait another 12 or 18 months or even 2 years or more for a vaccine. And the reason he says that is because they're applying an at-risk strategy to vaccine development. And the risk here is a financial one, not necessarily a medical one or a safety one. Because what they're doing is they've already identified a number of vaccines that they think might work, but they won't really know until they put them through a decent amount of testing. But what they've started doing already is to, to develop all of those vaccines or a number of those vaccines, the ones that they think have the strongest chance of success. And so once the final testing is done and they're satisfied with those results that this vaccine or these vaccines are the ones that are going to work, they're already well down the road to actually producing those vaccines. They've already basically made them, so now they can just start distributing them straight away. The biggest issue with this vaccine development has been once we get a vaccine and then we have to test it and then we've got to try and manufacture it and then we've got to distribute it. So it's a very long-winded process. That's why people say it's going to take so long. But by getting a head start on the production of the vaccine, as soon as the tests prove it to be safe and to be the right vaccine or vaccines, then we can just roll it out. Now, the at-risk strategy is something that I think, if you think about it, you could apply to many different business scenarios. The thing is, you've got to determine what the risk is. Is the risk going to be brand reputation if it doesn't work? Is the risk going to be financial, like it is with this case? Is the risk going to be missing out on another part of the market? The at-risk strategy can make sense. In a case like this, I think it makes perfect sense. If we can afford to do it, let's do it. I don't know how that is actually impacting other countries. I don't know what other countries are doing in terms of at-risk vaccine development, but I certainly hope they're all doing the same thing. Alrighty, that is it for today. I do thank you for your time, and I will be back again tomorrow. See ya.